All right, doing a check-in, was chatting to Cal, got a bit of information about this video. I haven't watched the video with the detail that I need to yet. I'm going to do that right now. I had a quick watch, asked some questions, and now I'm going to go back and watch the video with the information that I have and hopefully teach you some cool stuff along the way. And if this is something that you're interested in trying, looking to get busy. At the moment, I'm not particularly busy. I know Christmas is coming up, but anything you can do to help a small business operate through a very busy period and through a very expensive period, that would be wonderful. So reach out and let's make something happen. Let's make some magic happen. Anyway, come on, Cal, give it to me.
I ain't about to show you my dick, but
Damn.
I think it's groin. It's like groin hip. It's been
So
like an impingement for I reckon about 3 months now.
I'll probably have to edit this for all the swearing, you dirty dog. Okay, so we've got hip groin is what he's saying, like deep, and then he uses a word like impingement, which, suggests to me that he's done a bit of research on the hip. That's awesome. It means that all of the stuff that we talk about, I can get a little bit more technical with, and he's demonstrating that with this understanding, he can then take the things that I say with a little bit more context. However, this isn't to dissuade anyone that hasn't got this information. I will help you learn this information as we go. It becomes very, very valuable whenever you go to see any clinician, if you can give them a bit more information that's relevant, instead of sometimes the vague stuff that we get, which, isn't bad. You don't know what you don't know, but if you're willing to learn, then I'm always willing to teach.
So say for instance, I'll be doing
So he just said impingement. He's just got some
in
impingement.
about 3 months now.
3 months.
So say for instance, I'll be doing laying leg curls or knees to chests. It's just like a sharp pain in my hip socket, but more rounded into the groin.
Hi, it's me and the aviary that I appear to be in the middle of, because all I can hear is birds right now and I'm trying to record. I'm about to say something really stupid. I'm going to fix this later, but don't listen to what I say right now. This would be if I was bringing my legs, I can't even get my fingers to do that. If I was bringing my legs up towards my hips and I was laying on my back, this is called a long lever leg extension. So I'm keeping my legs long and the lever here is long. And then when I'm bringing my knees up to my chest, I can't even do that. Man, your feet, oh wait, what's he doing? Oh, is he down here? Okay, I was gonna say. So when I'm bringing my knees up to my chest, it's called short lever extension. So I'm shortening the lever here at the knee and I'm creating that same level of hip extension, but things have changed. He's given me 2 examples and he's given me great demonstrations too. Cool tats.
Chests.
He's actually got sick tats.
It's like a sharp pain in my hip socket, but more rounded into the groin.
More rounded into the groin. Oh yeah, that's right, he showed
There.
me. Okay.
Like the attachment right in my hip.
Let's keep listening.
Yeah. Any recommendations?
Okay.
There. Hip socket, but more rounded into the groin. There.
Here's a note as well for any clinicians. He's demonstrating on the anterior, but if it's this deep, it's probably something on the posterior thigh, that deep in the posterior thigh. So maybe some sort of quadratus femoris, or even the obturators or the gemelli group, something deep. Let's keep listening again.
Like the attachment.
He said rounded into the groin too. So, that kind of feeling. If you're doing hip flexion. I said extension before. Yeah, I'm a dummy. So if you're doing hip extension, far out, I'm doing it again. All right, so stupid. Pay attention. So when we do hip flexion, and then hip flexion, long lever and short lever hip flexion, he says it's rounded into the hip. He's demonstrating on the anterior, but we are thinking posterior and deep, and then that validates his words there, where he says it feels rounded into the hip. So it's probably something through the posterior that's pulling on that really deep internal hip. Now, knowing what I know about Cal as well, because I've worked on him both in person and online, I've seen how he moves, and I've assessed him with my hands as well back in the day. I know that his pelvis is quite rounded forward, and he's got a nice big lumbar curve, which is called a lordosis. Now, it's not uncommon. Most people have these, and it's usually just a postural awareness thing. But sometimes, in Callum's case, he loves chasing strength, and he's a bigger guy. Like, he's pretty solid. So when he picks weight up, it works in his favor. But he also has to carry that weight around. So that extra weight pulling us forward has a tendency to pull our hips into that shape and pull our back into that shape. There's a few ways we can work around it. We can develop the posterior chain a lot more, which will help. But there's also things that come into play like weight management, which isn't a big issue for Cal. He loves being strong, and I love him being strong. So I don't really need him to change anything in that area. But that can be a factor that we think about when it comes to these postural positions that we are pulled into rather than what we can find our way into. And then sometimes it's just we're tight as hell. And if we're tight as hell from a lot of sitting or doing things in front of our body, that can have an impact on that as well. So there's a couple of levels here. There's some performance levels to it. There's some body composition levels to it. And then there's like work related things to it or common practices that we do related to it.
Right in my hip. Yeah. Any recommendations on what to do to try and help release that part of my hip?
Sure do.
Because like even standing still and doing just a vertical raise sets that same spot off on the inside, like the groin side.
Cool. So he performs a standing short lever hip flexion assessment. Says that still hurts, which I clarified with him in the chat. Says that still hurt him as well. And then he tells me like right deep in that hip on the inside of the groin. Now there's a lot of factors here, of course there is, and I'm not going to say that any one muscle is the contributor, but this is where my brain is going. If it's deep and it's that deep into the hip socket, then it's got to be something that is directly interfacing with that section of the hip, but he's showing me anteriorly and he's showing me superficially because he can't get that deep. So my mind, it's posterior, not anterior. There's definitely going to be some hip flexor at play, and again, I'm not going to pinpoint this straight off the bat, hit a bullseye, but what I am going to do is let this help me infer my my exercise prescription and perhaps some of my soft tissue intervention. I'm very tired, man. I can't speak properly. So let's think about the posterior thigh, which we already did when I was originally watching this. That's why I opened this actually, because here we are, we're ready to go. So I haven't had a chance to look at it though. So what did we say? Posterior, and he feels it through. So yeah, probably something like that quadratus femoris. And he's also going to be internally rotated through his thigh because of that anterior tilt. That will naturally internally rotate him. So let's think of a more global approach as well. I don't want to go pinpointing in that quadratus femoris. That's super deep. I'm not going to expect Cal to jump on a trigger point ball and be able to get deep enough to hit that. So we've got to work the layers of the hip. So we're stuck in internal rotation. So we're going to start creating a little bit less tone through that external rotation and maybe start working our way in through that back hip, that back pocket. So we're going to go, it's going to be way more superficial to start with. Me again. I'm about to do something pretty dumb. Stuff that I just had open that I stupidly closed. Let's do this. Let's do this. Open in a new tab. We've got that there. We've got that there. Okay, happy days. So, this works as a protective sheath for the posterior hip capsule. Its goal is to absorb shock, so when you land on your butt, you don't crack the head of your, or the neck or the head of your femur into your hip socket. Or the head of that hip socket, the head of that femur butting into your hip socket, you don't do any internal damage either. So the glute max, my God, I'm so stupid. It's like right here. The glute max works as a protective covering. We have to work our way through this layer first. This layer will have different tension points, completely biased by how much tone or how much tension is being put into this external protuberance here. This is called the greater trochanter. And on this side, you can see the greater trochanter and how much tension we are going to be putting on that from the inside here. We're going to be pulling this really tight. So cause and effect, the outside is going to be pulling against it to equalize the pressure of the hip. So this is going to have different, based on how all these fibers move, this is going to have some different tension points across the width and the breadth of this very big piece of tissue, this big piece of meat. So we're going to need something. If I didn't know Callum and someone was maybe a little too sensitive to this kind of treatment, I would suggest something broad like a foam roller that has no ridges or bumps on it, and very gently start working the tissue like you're working dough with a rolling pin. Just for a couple of minutes a night. We do that for a week, and then we reassess the tension or the sensitivity, not only through the glute, which should have, based on the research, should have reduced. And then if this tension reduces, we might see a normalizing of pressure on this internal hip capsule, and that could improve the sensitivity. Now, this is something I could do in person. It might take me 5 minutes, but Cal's not 5 minutes away. He's about 2.5 hours away. So this is how we're working the problem together, and I'm not concerned that he has a hip injury. He might get one if he keeps doing this, so we've got to be mindful of that. I don't feel like this needs to be referred out. This sounds and is behaving like hip impingement, and I'm confident that after about a week, I'll know if we're on the right track. If his symptoms progress, get worse, obviously we refer him out. And if his symptoms ease, we've always got the referral up our sleeve, but for now, the treatment is working, so let's continue with the treatment. Okay, we've got to gently work our way through this glute. Now, I know Cal. He's got a trigger point ball, and he knows how to go the perfect amount of hard. So we're going to work on all of the fibers across this back arch, all the way down the inside of the tailbone. So we're up near this white stuff, but we're not trying to go cranking on it because we have some bones here that we don't want to pulverize. So we think maybe 50 to 60% body weight through here. Then we can gradually get out to what we can tolerate below 90% body weight. So we don't want to be putting all of our body weight on this glute. What this does as a protective cover is it absorbs shock. So if we compress on it, it's going to compress in on all the tissue that it's covering. And that might put more pressure on this greater trochanter, and it might even put more pressure on the inside of the hip. So we could be making this worse if we go too hard through here, and we have to wait for this to recover, for this to get back to where it was before, only to reassess and see where we're at. So, if we go too hard, too fast, it can actually set us back. So we want to go out to what we can tolerate, nothing above 90%. And then as we come out towards this greater trochanter here, this bony protuberance to the outside of the leg, so it's not your hip, that's your hip, your pelvic region there is your hip, and where the hip joint is where your femoral head and pelvis intersect. So your hip is this, and that's your leg bone. We have to be very mindful here. That's your leg bone. So we're out on the leg bone now, and this is going to be less than this to start off with. So we're going to be working below 50% body weight. So we have to use our arms and our opposite leg a little bit more here. Do a bit of gymnastics, bronastics. Less than 50% body weight through here, and spend a good few minutes here feeling where the ball wants to take you. It might want to take you back this direction. We don't have to go all the way back into the meat, but as you can see, we've got some of this white stuff. So it might want you to just come out here and creep through here. We can take this out to a little bit more sensitivity as we get towards the meat of the middle of the glute. But again, don't get drawn all the way back out here. It's nice to do that, and if you have the time, that is the perfect way to treat this muscle. You let the ball take you where it wants to go. If it takes you back out to this thick piece of meat, then that's where you go. But treating this glute might take you an hour, and if you've got the hour, great, and your hip might feel sick afterwards, but it can take a lot of time, and we want to be conscious of our time investment. So if you've only got a little bit of time, we work through here, then we work out into the meat, then we work our way to the bony part of the leg, and then gently just work our way back out. But if you're on a time constraint, just work it like back out to this white stuff. So you're not quite in the meat, you're more through where that hip joint is. So we're thinking about the top of the hip, the bottom of the hip rather than the top of the leg. Even though this is deep in here is the top of the leg, but thinking about the hip joint. So we work our way into that white stuff. As we treat this, this will reduce some of the sensitivity and the tone that we're holding, which would be great. And if it does, it may reduce some of the sensitivity and tone here. So if this one's for you, Callum. Once we do this, we work on this glute. Let's then do another standing test where you're standing up and you're doing that short lever flexion. You're just lifting the leg up. So do it before, then treat, then do it after. See if there's a change. If you're wanting to add a bit of depth to this assessment, which I know you will, go ahead and grab yourself your 20 kilo kettlebell, because I know that's the heaviest you've got. Stand up nice and tall, hold the kettlebell in your left hand, then do that left leg raise and do it with the short lever, so knee up, and then do it long lever, so foot long, and we're bringing the toes up towards the head. Don't go too fast, but gauge what you feel at the end of that range, and then gauge how much range there is. Get video if you can, that'd be awesome. Then we'll do all of that treatment, then we'll do that assessment again. At least we'll know that your body needs to have a bit more load in the system. So if we had the 20 kilos in your hand, your pelvis may reorientate in order to stabilize. And if it does, then it tells us we may need a bit more load in your system, and we may actually need to develop some of your anterior and some of your posterior chain in different ways that work off each other. But if it adds more pain, then it could be that adding load is going to make the hip worse in the short term. If in doubt, swap to the other hand as well. Check both sides. Let's see how it's all moving. All right, I hope that helps, my man. So, bit of trigger point through this. Spend a good couple of minutes on it. I know what you're like. You know what I'm like, man. We'll sit here for 45, 50 minutes and do this. So, if you want, hang out through here and then work your way towards this thigh bone, and then let it guide you back to here. You'll get some really nice trigger points in there. The hip will start to open up, and if you're wanting to get a bit of input from these muscles as well, think about the direction that you're taking the leg. So if the leg is on the floor and you're working the ball through your glute, once you've got a nice little trigger point, very gently see if you can equalize the pressure of that trigger point to some sort of tissue that's deep in your hip. So this will take a little bit of concentration from you, my man. You'll have to relax the leg and put enough pressure into the ball that it's not creating the whole leg to go tight in that big pain response. Or if you do, then you have to sit there and breathe and let it all relax. And when it does, then you might be able to access a bit of that deep hip. Just get a bit of contract, relax. I know you love to connect to that muscle tissue, so there's a little game you can play for yourself. Whenever you change the position of the leg or hit a new trigger point, that's the game you play. You let your hip relax, you let your thigh relax, you let your calf and your foot relax, and then you try and get that deep tissue that you're trying to relieve. See if you can get it to contract and relax. Sometimes, if it's overly tensioned, overly toned, it will cramp. If it cramps, well, you're in the right spot. Now you have to equalize pressure into the ball so that you can get a bit more glute and take that cramp away. Let this muscle burn itself out, and you'll feel the whole hip just melt. It'll be chef's kiss, my boy. A chef's kiss. All right. That was sick. I don't know how long it was, but I had a lot of fun. 18 minutes. I had a lot of fun. I might just upload this whole thing to YouTube. I'll ask Callum. All right. Hope you learned something. Again, if you'd love to help and support a small business through a very expensive time of the year, and help me put some food on the table for my family, that would be amazing. So I know it's getting a little tight with money at the moment, but reach out, chat to me. Let's see what we can work out, and then let me help you get better. Or allow me to help you. Don't let me. Allow me. I'd be honored to make you better, make you stronger, make you move better, help you move better, help you be more confident. All right. Big love. Thanks.